Hi everyone, this is a video for the Cirrhosis song brought to you by For the Love of Path. And so the Cirrhosis song is going to go to the tune of The Ants Go Marching. The liver is important and I'm sure you'd all agree. It cleans out all our toxins and helps us to stay lean. But alcohol just wants it to die, cirrhosis giving a wave goodbye, and a long list of symptoms that you need to know for the boards. Portal hypertension likes to help the GI bleed, plus angiomas on face and hands and breasts we've never seen. The skin turns yellow or maybe brown, depends if there's iron all around, and you may smell sweet or musty, it depends on the pathology. MCV of anemia goes up just like PT, with albumin and clotting factors dropping below 3. Then asterisks and atrophy, plus some splenomegaly, and your ankles start to swell like your guts, and then your brain. Alright, so now that we've sung the song and we've had a chance to take a look at the multiple different symptoms of cirrhosis, we're going to break down those major symptoms so that way you can find different ways to remember the important clinical features of them. So one of the big symptoms of cirrhosis is going to be portal hypertension. So what we know is that the portal system basically drains into the liver because that's the capillary bed that it's going to go through. And so when the liver becomes a huge ball of scar tissue, the vessels themselves also get damaged. So now that blood from the intestinal tract has nowhere to go. Instead, it gets backed up and then starts creating these dilated vessels or varices, specifically at the portal caval anastomoses, so where the portal system and the systemic system meet. There are 3 of them in particular that you should know about, and that includes the esophageal varices, which are where the esophageal veins and the left gastric vein meet. The caput medusa, which you will see over the abdomen, that's where the periumbilical veins and the epigastric veins meet. And then also hemorrhoids, which is where the superior rectal will meet the middle and inferior rectal veins. And so the big problem with these dilated veins, and especially for the ones that are within the GI tract, is that they are constantly being pushed around by food, and so there's friction over the surface. And what that means is that these varices are more likely to bleed. When the esophageal varices bleed, normally what we see is vomited blood or hematemesis. And so this can either be bright red, or if the blood has already had a chance to go into the stomach, we may see more of a coffee ground material. And so both of those could indicate possibly a ruptured esophageal varice. If this happens in the rectum, or basically close to where the hemorrhoids are around the anus, then what we could see is bright red stool. And this is known as hematochezia. And so those are some of the things that you will be seeing with this portal hypertension. So in addition to that, the other places that the blood backs up into is also going to be the spleen. Now, think about what the spleen does. The spleen basically filters red blood cells, and so it has all these little open sinusoids for the red blood cells to filter through. And then we also have that nice big splenic vein from the portal system that runs along the pancreas. And so that splenic vein is going to engorge and then basically cause the spleen to enlarge. So what we can see in patients is that now the spleen is very palpable. So those are some of the big signs of what you will see for portal hypertension. The next thing we're going to look at is also peptic ulcers. So one of the bad things that can happen is patients in particular who are on NSAIDs and they also are doing a lot of drinking, this puts them at an increased risk for having a peptic ulcer. And so again, what we normally see this as is that it's going to be causing a GI bleed. Now because it's in more of the upper GI and not necessarily in the intestine, We usually see this presented as melena, which is where we have black tarry stool. And again, that's because the blood has had a chance to be digested by the pancreatic and stomach enzymes. And so that's why we see the stool looking that way. This is in particular important for patients because we have a lot of patients coming in to the emergency room due to a GI bleed. And so you definitely want to be concerned if you have a patient with a known alcohol history for this reason. Another key symptom of cirrhosis is also going to be hyperestrogenemia. And so this occurs because when the liver becomes damaged, it's not able to process androgen hormones correctly. And so in particular, what we see is that there's an increase in estrogen. So in males, we can see a lot of these symptoms more prominently because males tend to have more testosterone in compared to estrogen. So now as that estrogen starts to rise, that's why we see a lot of these symptoms really occurring. So one of the big ones that is important to note is the spider nevi or spider angiomas, and those can occur on the face or other parts of the body, as well as the palmar erythemas, because estrogen does have an effect on the vessels. In addition to that, the reason why I mentioned breasts we've never seen is because for men who are not normally going to see breast tissue appear, they can have gynecomastia. And so the big thing to remember, though, is that gynecomastia can be caused by multiple different things, not just high levels of estrogen. So aldosterone antagonists, which some patients may be using for their renal failure, such as spironolactone and epinephrine, are going to basically cause gynecomastia as well. Also, prolactin-secreting tumors can cause gynecomastia. So this is where taking a good physical and history is important. So that way you make sure to check everything else before you just give this patient a diagnosis of cirrhosis. And so another thing that can happen is testicular atrophy, again, because we have that change in the balance of androgens. And most patients actually won't notice the atrophy first. They'll notice the erectile dysfunction and then the atrophy afterwards. But these are some of the common symptoms that you will see with hyperestrogenemia. So jaundice is also another important symptom because the liver is being damaged, and this is where we do our processing of bilirubin. So the important thing here is that the type of jaundice that is caused by cirrhosis is going to be a hepatic jaundice. And what this means is that when we're running our lab test, we're going to see an increase in bilirubin, and it is going to be split between conjugated and unconjugated, almost 50-50. And so this makes sense because unconjugated bilirubin from the blood is able to get into the liver, but just not all of it is being processed. And it's not because the liver can't do it. It's not because there's an influx of hemolysis. It's just that it's not able to get all of the conjugated bilirubin to the biliary system, and so some of that conjugated bilirubin leaks out at the same time. So this is why we call it a hepatic jaundice, and those are some of the main things that you want to know. In addition to that, while yellow skin is often what we associate with jaundice, scleral icterus is going to be a really good indicator of true jaundice. And so when you think of jaundice, one of the things you want to make sure to do is to look at the eyes. So the liver is also really important for metabolizing ammonia because ammonia is toxic to us. We want to make sure to turn it into urea and then have our kidneys basically flush it out. So when our liver is damaged and not working properly, we now start having high levels of ammonia. So what this can do is essentially cause a swelling of the brain, known as hepatic encephalopathy. And this can cause confusion and eventually coma. But one of the specific signs that also occurs is this coarse hand flapping known as asterixis. And that's a finding that we normally see with hepatic encephalopathy. The other thing is that your body is trying to get rid of the ammonia somehow. So one of the ways that it does this is by breathing off that ammonia. So if you smell a patient's breath, it might have a musty odor to it, and this is known as fetor hepaticus. So these are some of the symptoms of a patient with high levels of ammonia. Another symptom that we may see is also macrocytic anemia. Alcohol is one of the few causes of macrocytic anemia, and this is because when the liver becomes damaged, it also damages the liver's ability to metabolize folate properly. So, as you remember, B12 and folate deficiencies are causes of megaloblastic anemia, where we're going to be seeing these giant cells that have an MCV of 120. Now the big difference here is that while cirrhosis does affect the folate metabolism, it doesn't affect it in the same way as a true folate or B12 deficiency. So the MCV will go up above 100, but it does not usually reach 120. Once it reaches 120 or above, that's when you want to start thinking about megaloblastic anemia instead. But you should remember that alcoholism can be a cause of macrocytic anemia. So in these patients, we also have an increased tendency to bleed, which of course, tack that on with their varices and the fact that they're likely to bleed just because they have food rubbing up against these dilated vessels. This is bad news for a lot of patients. So remember, a lot of our coagulation factors are going to be coming from the liver. If the liver is damaged, it's not able to make those coagulation factors either in the right quantity or even correctly. So what we see is when we do a PT test is that the time is going to be prolonged because those coagulation factors aren't working properly. They're going to take a longer time to actually make a clot. And so even though the clotting factors go down, the PT is going to go up. And so the other reason why it's good to test PT for this in particular is that your vitamin K factors such as 2, 7, 9, and 10 are going to affect the PT, specifically number 7. And so in the liver, that's where vitamin K is being processed. It's used to make those coagulation factors. So it makes sense why we want to do PT just like what we do for Coumadin, because Coumadin is going to affect your vitamin K factors. Another major problem that cirrhosis can cause is hypoalbuminemia. And this is really important because not only does albumin help to carry a lot of compounds such as unconjugated bilirubin to different parts of the body because those compounds are not hydrophilic or water soluble, but it also helps to maintain oncotic pressure within the vessels. So that way we can still keep water within our vessels and not just have it go into our tissues causing edema. So when we have a decrease of albumin, what will happen is that the oncotic pressure is going to be relatively greater than what's in the vessels, and so the water is going to follow the oncotic pressure and go into the tissues instead. And then that's going to cause the edema that we'll see in the ankles and then also within the gut. And so this ascites that we see is commonly associated with cirrhosis, and especially what you can do with a patient is that if you push on their abdomen, you can see a fluid wave, which is a physical finding associated with that. And if we were to do a peritoneal centesis, what we would find is that by measuring the protein levels and comparing it with the serum protein levels, the ratio would be less than 0.5. And what that means is that the amount of proteins within the peritoneal cavity is less than what we found within the serum. And the reason why that's important is because it's saying that this is a transudate versus an exudate. And so that's going to help when we're trying to diagnose why this patient has ascites. So the last symptom I want to talk about, because it was specifically mentioned in class, is the exacerbation of hemochromatosis. So to be clear, a patient who has cirrhosis will not necessarily develop hemochromatosis. But if a patient is already predisposed to hemochromatosis, the alcohol that causes additional liver damage is going to spur this hemochromatosis to be shown more readily. And so the classic triad that is seen with hemochromatosis is cirrhosis with diabetes, because the iron deposits will go into the pancreas and destroy the islet cells, and then also a bronze skin. And so the reason why this happens is because the iron deposits go into the adrenal glands and then cause destruction. So when the pituitary gland does not receive that inhibitory feedback from the adrenal hormones, it starts trying to produce more of the precursor molecule to ACTH, because it thinks it needs to stimulate the adrenal glands more to make more of those adrenal hormones. It also ends up producing increased levels of melanocyte stimulating hormone, or MSH. And so when we have this increase in MSH, we're going to see a darkening of the skin. This is the same reason why when we have a patient who has Addison's disease, they will also have a darkening of the skin, because again, they're not having that inhibitory feedback up to the pituitary. And so this is classically called bronze diabetes. And so if a patient presents with something like this, you want to check and see if they have any alcohol in their history, or if they have any family members who may have signs of hemochromatosis as well. All right, that's it. I want to make sure to say thank you for watching, and I hope that you guys find this useful in your studying.